The most common side effect of streptomycin is ototoxicity. Hepatotoxicity is seen in isoniazid, rifampicin, pyrazinamide. Nephrotoxicity more common with immunoglycosides like gentamicin, no streptomycin. Ototoxicity. Streptomycin is an immunoglycoside. Adverse effect of pyrazinamide is hyperuricemia. Neurotoxicity seen in isoniazid, hyperuricemia seen in pyrazinamide, decrease uric acid excretion, cause gout. Flu syndrome seen with rifampicin. Acidosis not main effect of pyrazinamide. Hepatotoxicity, hyperuricemia, gout are adverse effect of pyrazinamide. Streptomycin not a ototoxicity, reprotoxicity. Pyrazinamide, albendazole cause bone marrow suppression, liver enzyme elevation rarely. The most common side effect of beta-lactam antibiotic is allergic reaction. The most common side effect of beta-lactam antibiotic is allergic reaction. Penicillin and cephalosporin hypersensitivity cause rash and anaphylaxis. Hearing loss seen with aminoglycoside. Yellowing teeth seen in tetracycline. Aplastic anemia seen in chloramphenicol. Morphine contraindicated in head injury because increased intraocular pressure, cause respiratory depression, cause mental clouding. The drug most associated with nephrotoxicity is gentamicin. The drug most common associated with serotonin syndrome is serotonin, cause serotonin syndrome, hypothermia. Metformin cause lactic acidosis. Diazepam, benzodiazepam, CNS depressant. Furosemide, loop diuretic, electrolyte imbalance, ototoxicity. Glaucoma is characterized by increased intraocular tension. Glaucoma is characterized by increased intraocular pressure. Adrenal cortex insufficiency seen in Addison disease. Why bread tastes sweet when chewed? Starch maltose. Starch converted into maltose by pethylene. HIV infect clinically controlled with zidobutane. HIV infection clinically controlled with zidobutane. Amantadine used in influenza A, Parkinsonism, Gengisiclovir, CMV infection. Acyclovir is a horse infection used in. The most common side effect of isoniazid by peripheral neuropathy. Optic neuritic seen in ethambutol, hyperuricemia seen in pyrazinamide, ototoxicity seen in streptomycin aminoglycoside. Ethambutol adverse effect is optic neuritic. Optic neuritic is a red-green color blindness, visual loss. Nephrotoxicity cause typically aminoglycoside like gentamicin, gout seen with pyrazinamide, ototoxicity is streptomycin. Ototoxicity is streptomycin. Rifampicin cause orange red urine. Gray baby syndrome, chloramphenicol. Yellow teeth, tetracycline in children. Bone marrow suppression, chloramphenicol, some anti-cancer drug. Streptomycin is contraindicated in pregnancy. Pregnancy causes congestional deafness, ototoxicity of two fetus. First line anti-TB drug not hepatotoxic, ethambutol. Isoniazid cause hepatotoxicity, rifampicin cause hepatotoxic, pyrazinamide cause hepatotoxic plus gout. Gray baby syndrome caused by chloramphenicol. Gray baby syndrome is caused by chloramphenicol. Tetracycline cause teeth staining, bone growth retardation. Penicillin cause allergic anaphylaxis. Ciprofloxacin cause cartilage damage in children. Tetracycline contraindicated in children because yellowing of teeth. Tetracycline contraindicated in children because yellowing of Teeth. Ototoxicity seen in aminoglycoside. Erythema seen with some arithmetic. Chloroquine contraindicated in children because growth plate damage. Ototoxicity aminoglycoside. Neurotoxicity through can see cause CNS excision. Teeth discoloration cause tetracycline. Aminoglycoside major effect of nephrotoxicity plus ototoxicity. Chloramphenicol damage side effect of aplastic anemia. Chloramphenicol damages side effect is aplastic anemia. Which of the following is a non-systemic antacid? Magnesium tricyclate. Which of the following is a non-systematic antacid? Magnesium trisilicate. Sodium bicarbonate is systematic antacid. Absorbed into blood can cause alkalosis. Sodium bicarbonate also systematic, produce carbon dioxide and sodium. Magnesium tricyclate non-systematic. Which of the drug induce Parkinsonism? Haloperidol. Arpinine is a non-steroidal anti-inflammatory drug. Haloperidol is typically antipsychotic. Block dopamine D2 receptor. Thalidomide tetragenic sedation. Centrally acting muscle relaxant is mepinephrine. Centrally acting muscle relaxant is mepinephrine. Halothane general anesthetic. Succinylcholine depolarizing neuromuscular blocker. D-tuberculin non-tuberculin NM blocker. Mepinephrine centrally acting muscle relaxant. Mepinephrine centrally acting muscle relaxant. Chlorothiazide is a diuretic drug. The heterocyclic ring present in 1,2,4-thiodine. Precursor of thyroxine, epinephrine and norepinephrine is tyrosine. Phenylamine converted to tyrosine but directly precursor of is tyrosine. Valine, branch chain AA, threonine, essentially AA. Epinephrine is added to local anesthesia is prolonged the action of drug. Epinephrine is added to local anesthetic to prolong action of the drug. Hemostatic vasoconstriction prolong action होची vasoconstriction. The diuretic action of acetazolamide is due to inhibiting of renal tubercular carbonic anhydrase. Low diuretic is furosemide. Sodium blocker with potassium blocker loss is thiazide. Study of how to body interact with administered substance is pharmacokinetic. Bioactivation is conversion to active metabolite. Biotransformation metabolism only. Pharmacodynamic what drug does to the body. Pharmacokinetic what body does to the drug. Pharmacodynamic what body does to drug. Insulin dependent diabetic is which type? Type 1 diabetic. Type 1 insulin dependent due to autoimmune beta cell destruction. Type 1 insulin dependent due to autoimmune beta cell destruction. Type 2 insulin resistance usually not insulin dependent initially. Drug induced from steroid. Gastrointestinal during pregnancy. Selective beta 2 bronchodilator used in status asthmatic terbutaline. Acetylcholine cause bronchodilation, bronchoconstriction. Terbutaline selective beta antagonist bronchodilator in several asthma. Isostamarine short acting beta 2 agonist. Potent inhibitor of CYP 450 enzyme cimetidine. Which enzyme class is dependent on ATP? Ligase. Hydrolysis breakdown using water. Transfer group something ATP indirectly but not essential. Oxidatives involve NADA FAD. Ligase require ATP to join two molecules. Ligase ATP to join two molecules. Lieberman Brunstad reaction test detect cholesterol. Lieberman Botsch's reaction test detect cholesterol. Phosphodiester bond is present in nucleic acid. Polysaccharide seen in glycosidic bond, polypeptide peptide bond, diglycoside ester bond.